So 3 new cases in Queensland overnight, all of them locally acquired, all linked to the Indooroopilly cluster and all in home quarantine. Now I'm going to go through them just so that people can understand that there is an ongoing risk, but as long as people maintain that home quarantine, we'll be fine. So one case is a student at Brisbane Boys Grammar School who tested positive on day 8 of their quarantine, so tested negative when they first went into quarantine and not infectious in the community therefore. The second is a student at Ironside who tested positive on day 7. Again, not infectious in the community, they tested negative when they went into quarantine. And the third is a household contact of 2 known cases from Brisbane Boys Grammar School who's tested positive on day 9 when they went into quarantine. So this is an adult, and again they tested negative when they went into quarantine. So I know how tough this must be for all of those people in home quarantine, but it's really important that they maintain it for the full 14 days since they've been last exposed to an infectious person. That's critical. So as people develop infection who are in those households, that 14 days quarantine unfortunately starts all over again for those people. So this will be very, very difficult for those families going forward, but it's critical so that we can limit the spread of this virus. And congratulations to Cairns. That 4,206 tests that were done in the last 24 hours is fantastic. That's an absolutely brilliant response from Cairns. I'd also like to comment about the work that the Public Health Unit has done up there. So you might remember that that marine pilot developed symptoms on the 31st of July, which means his infectious period went back to the 29th of July, 2 days before. But he was fully vaccinated, and we know that can change whether or not someone gets any symptoms at all. So therefore now we've got this information from New Zealand about the ship that he piloted. He came off that ship on the 23rd of July, and we think that's probably where he acquired it. We're going to have to go back and contact trace to the 23rd of July. Then that taxi driver took the pilot to the airport on the 26th of July, and we know through whole genome sequencing that those two are linked. But that was before we thought he was infectious, which is why he wasn't picked up on contact tracing. But we're now going back further. So people in Cairns, there will be venues put up there, and please just take note, because you might have been in one of those venues going back to that 23rd of July. That's really important. Now, in terms of the border zone, as you've heard from the Premier, New South Wales has declared 4 of the LGAs in the border zone that we have in place as hotspots, and they've put in place stay-at-home orders for those 4 LGAs. So it's really important that anyone in Queensland who's been in any of those 4 local government areas since the 31st of July, which is the date when that man drove up from Sydney to Byron Bay while infectious, that you now are bound by those same requirements that New South Wales has put in place. So anyone who has been in those 4 LGAs and they've gone anywhere else out of those 4 LGAs, whether in New South Wales or in Queensland or indeed anywhere else, now needs to stay at home except for those 4 reasons that we're all used to. So it's really important because he was infectious in the community from the 31st of July. Now, it's been confirmed that he never travelled into Queensland. He travelled from Sydney to Byron Bay on the 31st of July. He never travelled into Queensland. So that is good. That's reassuring. But having said that, anyone who's been in those 4 LGAs while he was there needs to now stay at home except for those essential reasons. Thank you.